reshoot. I'm sorry. There's just too much dog background noise on the previous shot. This is a reply video, really. I had a commenter note on one of my older videos about life skills that it was only dealing with one skill. And in a lot of these videos, it's just venting out and just saying whatever's on my mind at the moment. And that was just something that came up. And the only skill that I noted on the video was parenting skills. And that's a big part of nursing, though. I didn't want to, it's so important. I didn't just devote the video to that. It was just a quick video, 5-minute video. And it delved into that a bit, and I gave an example, like I normally ramble along like I am now, about skills we, as Joe Blows, regular people not in healthcare, bring to healthcare. I was a manufacturer for 30 years, business, and I knew nothing about healthcare. I didn't know a syringe from a flush. So, I came in completely clueless. I could barely put on a Band-Aid. But I did have certain skills. I had parenting skills. This is my third time around, actually, right now, as a single parent. I've had custody all 3 times. I raised the first 2 sets. Looks like I'm going to be raising the 3rd set on my own, too. You think I would learn, right? No, I'm stupid. I'm stupid, emotionally stupid. But ironically, emotional intelligence is what gives me an edge over the younger nurses. I don't want this channel to be younger versus older, but a lot of times we're talking about older nurses, and that was really kind of where that video was coming from, was, what we bring to the table, but it can apply to younger nurses too, as laymen. In that video was about parenting skills that other people don't have, non-parents. An example I had was an experienced nurse, no slouch on hers. I forgot how many years experience she had at the time, but she was out of her norm when she was floated to peds. Whereas for me, I'm used to dealing with kids of all ages, from neonates all the way to 25-year-olds. Congratulations to my daughter. She just graduated nursing school. She's just waiting to take her NCLEX. But it is skills that we bring to the table as older adults of interpersonal skills. And maybe parenting is one aspect of that, obviously. That's a certain subtype. But when I deal with an adult, it's different. I'm dealing with contracts, I'm dealing with business. It's something totally different, a salesman, whatever. So these are skills that you bring to the table as a non-nurse. So that was the whole point of that video, and I'll go into it in this video, because her complaint, that commenter's complaint, was you only gave one skill. And she's absolutely right. I only gave the parenting skill, which I thought was pretty more geared to my audience anyway. But it is also probably the most important skill that I bring to the table, I thought. But as I look back and I think about it and think about what her critique was, she's right. There are other skills I bring to the table, you can bring to the table, even if you're not a parent. If you've been a customer service agent, if you've been any kind of business-oriented person, like a salesperson, you're selling a pitch. A lot of nursing is interpersonal interactions, especially bedside. Probably, I wouldn't even say more so for bedside. Just about everything. If you're a school nurse, camp nurse, a lot of what you do with your patients, if you're dealing with patients, there are a couple of fields that don't deal with patients, is interpersonal interactions. You're calming the person down, you're reassuring them, you're gaining their trust so that you can either do the procedure, you can explain the procedure, or you could just listen. Hospice nurses is a great example. They're dealing with a specific situation in life and death. I've known a couple of hospice nurses. I've dated a hospice nurse. They have a skill set that you have to, help the patient finish their journey. You have to help the patient's family adjust to the end of the journey. And it's not easy. It's very, very emotionally trying, and this is just off the rails for a few seconds. A big part of nursing, which is difficult, is the emotional toll it takes on you on that. I would say the most traumatic parts of my career so far has been those aspects. I think I could be a hospice nurse, but I don't think I could do it all the time. I just don't think so. It's just like peds. I thought I could do peds. I don't think I could take that trauma back with me. It's just, I no matter what I clock out, it's easier to clock out when I'm dealing with adults. With children and hospice, it's a totally different kind of animal, because what the hospice nurse's job is, and the peds is just very traumatic. It's traumatic for me. It might not be for you. It might be fine for you, and that's what I'm saying. The interpersonal aspect of nursing is so important. That's why I focused on that video for that. But just as simple as accounting or project management, you think those are just pretty objective skills. I'm dealing with numbers, I'm dealing with this, projects, I'm corralling people. Guess what? Nursing is part of that. That's a big part of nursing. You're bringing together the care team, you're doing wound consults, you got to bring a nephro into this, you've got to bring palliative into this, you got to talk with pharma, you got to talk with the physical therapist, occupational therapist, the care managers, the social workers, the families, the providers. You're doing that. So every nurse has got to be a project manager. Every nurse has got to be a customer service manager, basically. Every nurse has got to be a parent on this. You make lunch for yourself or your kids or your husband or your wife or your loved ones. You caretake for them. That's a big part of nursing. I have had a number of commenters say they want to get into nursing after taking care of their loved ones in a hospice situation, or while they're still doing that. I had a classmate, she was a widow, family bankrupted themselves trying to save her husband, because what was the point? Otherwise, she was like, I'm not saving for anything. I'm going to try to save him. We lost the battle to cancer, but she learned so much in that she also needed a career. She was a tech for, I think, 12 or 13 years, put her three kids through college, two of them through college, the third one was just starting college as she graduated with me. But she finally became a nurse, and she toiled hard, but it was something for her that it triggered in her that caretakerness, that feeling. And a lot of my commenters I've seen through the comments, they had that experience. That's an experience you bring to the table. You're like, oh, I don't know anything about healthcare. I said, you actually do. A lot of what we do is also educating people. So we teach people how to take care of their loved ones at home, whether it's in hospice or a chronic long-term scenario. I've had a number of teachers. I have a tech who was a teacher for 10 or 11 years, I forgot. And she's in nursing school now and finishing up, and we were talking about this, and I was like, no, how you dealt with your students, right? And she said, you're right, it's interaction, that interactive, interpersonal interaction is very key, so like you're a salesman. If you've been a salesperson at a car dealer or whatever, a cashier, you're dealing with people, you're dealing with numbers, and a lot of nursing is numbers too. Guess what? MedPass. You've got to be very exact there. You've got to be exact on your register, right? You say, well, this is drugs. Well, for a banker, money is more important, right? So you got those aspects. If you worked in the bank, all these life skills that you bring to the table, don't think that it's poo-pooed. It's very important. It's very applicable. Even if you could just drive a car, if you're operating a piece of machinery, guess what? You might do respiratory. You might do your pump, your med pumps. There's applications if you're a plumber. I had or some kind of even hands-on job. I had a landscaper become a respiratory therapist. He was a late 30s. I think he was 36, 38, and And he's like, oh, I'm giving your job, your account to my cousin. I'm becoming a respiratory therapist. I was like, well, congratulations, I just became a nurse. You know, it was crazy. Midlife change, right? But a lot of the human body, as you find out in your classes in anatomy, physiology, is a pump. You're dealing with a machine. So the whole point is to keep your brain perfused, right? Keep your organs perfused. So hydraulic, if you know anything about hydraulic stuff, fluid dynamics, you know, that's fine. If you don't, that's fine. If you know how to cook, guess what? That applies to medications. That applies to this. Don't sell you guys short. That was the point of the video. At the end of the video, hopefully she stayed to the end. It was just a general video, and it just pulled one life skill. But there's so many skills that you can bring to the table. You know, I fixated on the parenting skill for that video because a lot of my viewers are probably parents or older, capable of being parents, or babysitted, or their nieces or nephews or what have you. And that is a big portion of how I nurse, and I'm just projecting onto you guys, is I treat my patients like family, and it's easier for me to interact with them. That's why I don't want to do, I don't like being in peds, I don't want to do hospice full time, is that I do project that and I take that home. You know, it's easier for adults because they're adults. I can sever that contact when I punch out. But it's a lot harder, you know, for kids and stuff. You know, you could identify them with my own kids and what have you at the end of life stuff for a hospice. But if you have had kids or you've taken care of loved ones, that's a great life skill that you bring to the table. People don't realize. They're like, I don't really know. I said, no, that's a huge part of it. And if you've done it for a while, guess what? You're most of the way there. Nursing school is the filter. You know, I always say to people, I say, nursing school is a filter. It's filtering out the people that really want to become nurses versus the ones that are kind of thinking of it. Still, the ones that are just thinking about it can still sometimes muscle through, you know, because it's not so difficult. It really isn't. And that's also why I preferred recommending the shorter diploma and ADN routes, is that it's a quicker route. 4 years doing that in a BSN route, the typical traditional BSN route, is really difficult. You know, that filters out a lot of people because it's just such a long race. If you kind of sprint run it with an ADN, not too bad. It's 2 years. Not, you know, you can muscle through that. Muscling through 4 years is really difficult because you're doing college and nursing. And a diploma, you're kind of in the thick of it. You know really quick whether you like it or not. So that's why there's so few of those programs. MSN and accelerated BSN programs are just kind of the same way. They just bombard you. And if you can survive that bombardment, yes, okay. But I find a lot of people can't. It's just too intense, you know. So that's why I think the ADN's a nice, really sweet zone for older adults, because it's a part-time program 99 times out of 100. You know, I actually don't even think of any, I've not talked to many, and none of them are full-time. They're all part-time. They're relatively easy. I've said this in the other videos. You guys can look for that. I don't want to get too far off the rails. But it allows us then to really bring our strengths to bear and still maintain our life, because you have lives besides nursing school. And those skills you can bring to bear on nursing, because it's just getting through nursing school, and then you learn to be a nurse on the unit. Don't worry about nursing school too much, other than passing. That's why I said to my daughter, I say, this is the hardest part. This is the hardest part. NCLEX is not hard, it's pass-fail. Getting onto the unit, once you're ready, you got your license. You can always quit and do something else in nursing. You don't have to be a bedside nurse. You don't have to do this. This is the advice I give to my own daughter. I'm being very straight up with you guys. Always straight with you guys. Bedside is not the only part of nursing. So there are other aspects of nursing that you can use your license for. Corporate. You gain a lot of credibility when you put the RN at the end of your name. So automatically that puts you to a lot of top listings. You know, as a former employee myself, I'll tell you that. Again, I bring other aspects to the table. So it's not just bedside nursing. It's not just that, you know, you have other skills that you can bring and leverage your RN to do. You don't have to do bedside. But, you know, I hope this fleshed out a little bit more of the life skills. If you guys have feedback, I do listen and I do try to respond to every comment. Not always with a video, but I do definitely respond to all the comments, and I try to flesh out things a little better, like this video. She pointed out very succinctly, this is only one skill. And I took that to heart. I didn't take it as an attack or blast. And even if it was meant as such, that's another life skill that you can bring, is learning to take critique. You have to learn to take critique and then turn it. Kind of a yin-yang type of scenario, although I don't practice. It's utilizing that and then building on that. You know, you have to build this is part of the reason you do this journey, is that you want to make yourself a better person and contribute to society, get back to society, whatever. That was a big motivation for me. Maybe it's just to get a decent paycheck or whatever. That's fine for you. You know, not for me. But you know, it's these things that motivate us, that, you know, make us try to do things better, make a better video for you guys. But I definitely want to hear feedback. Say, look, what about this skill? What do you think? I'll answer. You know, I don't think of everything. Like I said, these videos are just kind of off the cuff. There's no script. There's nothing here. We got dogs barking in the background, kids screaming around, although they're older kids now. But it's definitely things I try to bring to you guys and hopefully help your journey along the way. Okay? Sorry for the long video. Good luck.